Hello everyone and welcome to Solve Autism podcast. I have great honor to welcome and have a conversation today with Dr. Richard Frye, who is a child neurologist with expertise in neurodevelopmental and neurometabolic disorders. Also, he's a medical doctor at Autism Discovery and Treatment Foundation and Neurodevelopmental Precision Medicine. Dr. Frye, hello and thank you very much for your time and being with us here today.
Well, thank you for inviting me.
For just a quick intro, I will read for our parents and those who may be our first time hearing for your practice. Just like a quick intro. Doctor received an MD and PhD in physiology and biophysics from Georgetown University. He completed a residency in pediatric at the University of Miami, residency in child neurology and fellowship in behavioral neurology and learning disabilities and at Harvard University, Children's Hospital Boston, and fellowship in physiology at Boston University. He also received a master's in biomedical science and biostatics from Drexel University. He holds board certifications in pediatric and in neurology with special competence in child neurology. He has authored over 300 publications and book chapters and serves on several editorial boards and is currently the editor-in-chief for the section on mechanisms of diseases of the Journal of Personalized Medicine. You have several areas of interest which includes also behavioral neurology, pediatric learning disabilities and psychology, child neurology, cerebral folate deficiency, mitochondrial disorders, metabolic disorders, and epilepsy. I would like to ask you at the very beginning, maybe what are the most common problems that you see in patients with autism spectrum disorder every day in your practice?
Sure. Well, children with autism spectrum disorders, many of them have multiple both medical and behavioral and neurologic disorders. And so it's really important to really have every child with autism have a comprehensive evaluation. You know, we commonly see problems with language and communication, which is very important. We know that improving communication and language will improve the ability to receive services and develop. As far as medical problems, which are very, very common, and can be sometimes easily treated. We see that many children have sleep disorders, which can be very disruptive, and problems with the GI system, the gastrointestinal system, that really need to be addressed. And these are two really simple things that can be improved and improve the quality of life of the child and the parent.
Mm-hmm. How you determined or decided autism to be your field of research in the first place?
I like to say that autism kind of found me. When I was doing my fellowship in learning disabilities, I was very interested in dyslexia. But when it came to my clinic, this is about the time that autism was being more recognized. Mm-hmm. And a lot of parents would come to me. So it was really driven by parents, and they'd bring their child with autism and say, well, they told me that my child has autism, and they don't know what's caused it, and they don't really know what to do about it except some educational therapies, and I think it has something to do with the brain, so maybe you could figure out what's going on. And I took it as a challenge, and when I first started looking at children with autism, I was very interested in these odd types of epilepsies that they have, and I started looking at that. I was a neurologist, I still am a neurologist. But that was my concentration at that time. And then as I looked more and more into children, I found that there was all types of other disorders, you know, including these very simple, you know, GI sleep disorders that can be, but also metabolic disorders, which are very much more complicated, which can be addressed, and many times it can improve the function of children with autism.
Great. So when parents are suspecting something is wrong with their child, or they have just got the diagnosis of autism spectrum disorder, what are the next step? What do you recommend? Whom to talk to, and what test, or what should they do?
They really need to talk to their pediatrician, of course, to see if they can be screened for any of these disorders and be referred to the specialists that have experience in autism. So many times we have, specialists with, in GI disorders or sleep disorders and such. And autism is really a different entity. So you really want to find one of these specialists that has experience with children with autism, because they're not like regular children. That is, for example, for GI disorders, a child with autism with constipation, for example, is not the same as a typically developing child with constipation, and they respond to different treatments. So you really want to make sure that you find somebody that knows the nuances of treating children with autism. Yeah,
thank you. So you area of your interest is, and maybe you are most known here on Balkans for treating mitochondrial disorders. Can you tell us, please, what that is and how it should be treated or supported?
Sure. Yeah. The mitochondria we think of as the powerhouse of the cell. So almost all cells in our body have a mitochondria. They have many mitochondria, anywhere from hundreds to tens of thousands of mitochondria, depending on how much energy they need. Brain cells particularly are supported by mitochondria. And so if you don't have the power to power your cells, they're not going to work very well. And so we find that, that many children with autism may have problems with mitochondrial function. And we're still starting to understand that. There's something called mitochondrial disease, which is a very severe form of mitochondrial dysfunction. And the numbers seem to suggest that's about 5% of children with autism have very severe mitochondrial disease. But the number of children with what we call mitochondrial dysfunction, where the mitochondria just isn't working well for one reason or another, ranges anywhere, the numbers are anywhere from 30% to 80%. So we're still trying to figure out and nail down how many children they are, out of the children with autism. But it's probably a lot. And so we know sometimes children with sometimes mild mitochondrial dysfunction can respond to different types of supplements that address these deficits and can support the ability of the cells in their body to work.
Can you tell about the deficit maybe from some symptomatic behavior, or it should be determined by a specific test?
Yeah, so it's kind of hard, and this is what we see a lot with children with autism, is that many of the symptoms that we would express, that we would think that a typical person would express in a certain way. So, for example, one of the common symptoms of mitochondrial dysfunction or mitochondrial disease is fatigue, extreme fatigue. But many times children with autism can't express that, so they express it in behaviors. And a lot of times all we see is disruptive behavior. And we don't see that what they're feeling maybe is fatigue and an inability to concentrate and an inability to engage. And so that's why we really need the test to tell us if maybe they fall into the subgroup where that part of the body isn't working well.
And when you introduce the mitochondrial support, what are the main improvements in overall
It depends on the child, but many times you see better regulation, better language, many times, sometimes better social engagement, more energy, better sleep, all of these things, better GI system function. So the whole body seems to be functioning better. And sometimes it just may be that the child is feeling better, and so they're more able to engage in other things like therapy so they can, recover.
Great, yeah. I know you had a lot of, you talked a lot on different occasions about cerebral folate deficiency, and I would also like to recommend our parents and everyone who will be watching this to look at those lectures. But in a short way, how would you determine cerebral folate deficiency, what it is and how to treat it?
So cerebral folate deficiency is low levels of folate inside the nervous system. It ends up that everything that gets into our nervous system has to go through the blood-brain barrier, and there's certain types of mechanisms, kind of machines that kind of carry, these nutrients into the brain. And sometimes they don't work. And we find that one of the ones that don't work in many children with autism is the transport mechanism that transports folate into the brain. And this can be for a variety of reasons. One, we find that there's this antibody that's floating around the blood. For some reason, the immune system is making this antibody that should be trying to protect us, but for some reason it binds onto the folate transporter and prevents that from working. Also, children with mitochondrial dysfunction, the folate transporter needs a lot of energy to transport folate into the brain. So if you have any type of mitochondrial dysfunction, that won't work either. Traditionally, really to make the diagnosis of cerebral folate deficiency, you would have to do something called a lumbar puncture or a spinal tap to measure the levels of folate in the nervous system. But now we find that the treatment for it, something called leucovorin, which is a special type of folate, is pretty safe, so that if we have some signs that the child might have some problems getting folate into the brain, either having the antibody or signs of mitochondrial dysfunction, we may try leucovorin to see if there's some type of response. And if there is, sometimes we see dramatic response with improvement in language, and sometimes we don't. We know that some of these markers that we measure predict response. They're not absolute, but they tend to predict response. And we're still learning about it, and that's why it's important to go to a doctor that's experienced in using the medications to make sure that it's done properly.
Yeah, great. I will have a few questions about that later from our moms that had a concrete experience with leucovorin and everything else. I would like to ask you about the correlation between GI system and all of these mechanisms that doesn't work. I know children with autism are often picky eaters. They mostly have diet that is full of carbs, probably proteins, but they would rather not include something that is full of, let's say, folates or vitamins. Do you think it has something to do with also this deficiency, maybe with inability to process folates, for example?
Yes and no. Definitely, there's the involvement of the GI tract in autism, and there's so many different areas you can go into. One of the things that we know is many of our vitamins that we ingest are processed. They don't always get automatically absorbed. They're processed by the gut bacteria that we have. And we know that the gut bacteria in many children with autism are altered. So they may not actually process those nutrients the same way. We also know that children with autism many times will have problems with certain digestive enzymes. There's studies that have shown that. We don't know what the percentage is, but there's many children that just can't digest their food. And that will actually disturb the GI tract in many different ways. And they may not absorb their nutrients in the same way. So any child that has any type of feeding issues, which is a lot, we do recommend a basic supplement to supplement some of those vitamins that we know that are so crucial for the body to work.
Yeah, great, thank you. I believe most of our parents are curious to know what is the percentage of children, if we can talk about that, that are recovered so far in your practice using biomedical treatments, both for ASD or neurodevelopmental disorders. Are their children or the adults with some of these disorders that have recovered fully, or in a way that they can live independently with most of their functions preserved, or let's say so they can function somewhat normally?
Yeah, I think there's a whole spectrum, and many times I think that treatments that we use, biomedical treatments, are thought to, people advertise them as cures for autism. And we do see some children that just make dramatic recoveries, it's really, really amazing and outstanding. But then other, children make incomplete recoveries, but it's still so important because they're able to become a functional part of the family and society, and really have what we call optimal outcomes. You know, and the optimal outcome may be different for different children, but you know, there's I think every reason to try and find what the optimal outcome is for every specific child.
You saw a lot of children also here in Novi Sad in Serbia for the past few days, and I have to say I see those props there. You have a little duck and all other kinds of fun stuff for kids. Just are those for to make them to keep their attention, or also for diagnostics? And I believe it takes patience to do all this.
No, you have to engage children, and I mean that's part of the diagnosis and part of the exam. If you can't engage them, then it's hard to actually examine them. So you have to have a little fun with them, you know, have fun toys, you know, things that pull their attention in, you know, and that's part of the diagnosis too, is to see if they will engage. If they see something unusual, is that something that catches their attention, and that tells you something about, you know, what's going on inside of their brain. So you have to be very creative, when you see children and you examine them.
Great. That sounds great. I have to ask because here on Balkans it is a tight line between autism spectrum disorder, and sometimes kids are diagnosed with some other kinds like ADD, HDD, or any other name that is now like developmental delay and things like that. And sometimes those non-autism diagnoses can be converted, or by time they convert them. So what I want to ask is, do all these mechanisms that does not function well in autism and treatments for them can be spotted and treated also in these other kinds of
Yeah, most definitely.
Issues.
You know, and so we see some of those same themes almost in all neurodevelopmental disorders. You know, and there's some good research that shows this, but we see mitochondrial dysfunction, oxidative stress, neuroinflammation, you know, all as basic processes that are seems to be dysregulated in almost all neurodevelopmental disorders. And then you see the same things too, sleep, you know, GI issues. So, you know, I think autism is a kind of a template which we can apply to many other neurodevelopmental disorders as we learn more.
Thank you for your answer. Autism prevalence has increased for 178% since 2000 year. Do you have some guesses what is causing this increase in numbers over the years? Does the scientific community has any clue what is happening and why such an increase in such a short amount of time?
Yeah, I think it's obvious that there's some type of genetic environmental interaction, some type of susceptibility, you know, with some type of change that's going on in our environment. What that exactly is, there's so many different examples, and the environment, you know, is a broad term, and we have to think of it in many different ways. A lot of times we think of, you know, environmental toxins, but that's not, you know, all that there is. It's also our diet. Our diet has changed tremendously, and that's changed our microbiome. And then what we're learning is that the most important environment, you know, that you're exposed to is that 9 months that you're in your mom's belly. You know, the maternal environment, we're learning more and more, is important for programming the child and how they react to the external environment. And just hopefully, you know, one of the things that we're really trying to concentrate on is how to improve that maternal environment, you know, to begin with, so a child has really a good start.
That would be also one of my next questions. So can we in some way predict autism and prevent and make their environment as well as mother healthy and
and I think that's in some ways part of the field is going to is to find out what those mechanisms are, you know, prenatally, and some of the stuff is the same things that we see after birth. We know that folate is very, very important, and it ends up those same mechanisms that bring folate into the brain are the mechanisms that bring folate across the placenta too, so there may be some problems with getting folate to the baby, which is, not new news, but we're starting to learn more of the nuances about it, and maybe how we can predict which pregnancies may need special types of folate. We see abnormalities in oxidative stress, in inflammation, in nutrition, and also in other types of toxins that the mother might be exposed to. Of course, in general, the best thing to do is to remember, to plan the pregnancy so that the body is extremely healthy, and plan it before, you get pregnant, so that your body is ready to, have the child grow in a healthy environment.
Yeah, how many months or years? What would you recommend if we can?
The sooner the better.
Sooner the better, yeah.
The studies, I believe, have looked many times to 3 months before. We know that seems to be still a critical time, but of course the healthier the body can be, the better probably it is, and the lower the chances are to have a child with neurodevelopmental disorders, but also it seems to be linked to other chronic diseases, including ADHD and allergies. So there's many other diseases too that seem to be linked to the maternal environment. Yeah.
Thank you for an answer. Here is a practice that very moment when pregnancy is announced or acknowledged, good gynecologists mostly recommend folic acid. So what would be your advice on that? Which form to take during pregnancy? And
right, yeah, no, it's kind of a tough question, because, we're still learning about it, but we understand that really folic acid, for many people, they have a block in the ability to convert it into the reduced form. So folic acid is the oxidized form, which is not bioavailable. Our body has to process it, and many times many of our bodies can't process it, and we're starting to learn that actually a buildup of unmetabolized folic acid could be detrimental, so too much. Whereas with reduced folates, that doesn't seem to be the case, although we're still, looking at it. One of the things is that all research has been on folic acid. So we know folic acid in general is good.
Yeah.
We think theoretically that these reduced types of folates would be better. And so, it's probably best to take a combination of those folates at not too high of a dose, but at a good dose. And I know that there's many companies that are making prenatal vitamins with reduced folates in them, so you have a nice mixture. But I don't think we have the perfect solution right now.
Okay. Yeah, thank you. But that's also good to know. We're really happy to have you here and to learn from you all of these new practices. And one of things that we heard and learned from you also, and that is not yet practiced here, is that EEG study for children with autism and other developmental disorders. You recommend, I believe, 24-hour of taping or
I believe at least an overnight EEG, but hopefully 24 hours.
Why is it important?
So first of all, there's certain types of epilepsies that can be treated that happen only in sleep. And many times they happen only in deep sleep. And it's important to get deep sleep, which takes time for the child to naturally go through sleep. And even if you were to get some deep sleep and then wake up the child, it's really important to see how much of deep sleep those discharges would be in. I think it's really important to get a test overnight, because many times you'll bring a child in, to get them to go to sleep for a short EEG. They're sleep deprived, so that's not their natural state, and usually they're very irritable when they haven't had sleep. So you get a lot of artifact on the EEG for a short period of time. They don't go into deep sleep. And then, many times parents have questions about things like staring episodes and certain types of movements that they suspect that could be seizures. And many times they're not. But I think it's always important to answer that question. So, those questions aren't out there.
Parents read a lot and hear a lot of different
Exactly. And they say, oh, it must be a seizure. And many times it's not a seizure, but sometimes it is. you know, and I think it's important to satisfy the answer in the parent's mind so that they know that their child isn't having a seizure during that time.
Yeah, great. Thank you for your answer. I would like to answer you now a few questions from our mothers from our association Deca bez granica, or Limitless Children, or what would be precise translation. So one mother would like to know what are your knowledges, or when it comes to the spectroscopy of the brain. Did you do the research that wise before and after the therapy?
I'm not sure which type of spectroscopy, but magnetic resonance spectroscopy is really still in the research phases, you know, so, you know, it's, of course, most of the time you need sedation to do that, so it's pretty...
I think, sorry to interrupt you, maybe this question is regarding folate deficiency, so before and after leucovorin or any other therapy for folates, did you measure shootings of the brain? Yeah. Right.
So spectroscopy probably would not be the most sensitive tool, but actually we are looking at functional neuroimaging. So we're doing a study where we're using something called NIRS, near infrared spectroscopy. So maybe that's what they're talking about.
Okay.
Sorry, that looks at the blood flow in the brain to see if there's improved blood flow and connectivity in certain parts of the brain. And then we're also using something called magnetoencephalography, which measures magnetic brain waves to see if there's better connectivity after a treatment with leucovorin. So yeah, we're trying to do that. You know, it takes a long time to do these studies, so we're trying our best, and hopefully within the next few years we'll have some answers and we can start to understand better what leucovorin is doing to the brain and how it's improving language in some children.
Great, thank you for your answer. Would you recommend levofolinate instead of leucovorin at this point? What are your thoughts on this?
So we chose leucovorin for a number of different reasons. You know, one of the things that's most important is it's a type of folate that's been used for decades in oncology to rescue the body from the effects of chemotherapy. And because of that, we know a lot about it. We know its safety profile. We know the dosing of it. So it's a kind of known quantity. So it's always good when you use something to have a known quantity. And so that's one of the advantages of using leucovorin. The other thing is, it's as far as folates go, you know, I consider it almost one of the perfect folates because a lot of people are worried about something called the MTHFR, you know, polymorphism, which is something that may slow down this enzyme. It ends up that when you ingest leucovorin, half of it gets converted into L-methylfolate by your gut bacteria. And so leucovorin comes in before the MTHFR and L-methylfolate comes in after. So by giving leucovorin, you actually have almost the best of both worlds because you do need actually folate to come in before that MTHFR because it gets shunted to something called making purines. And purines are very important as the building blocks for our DNA, our RNA, for ATP for the mitochondria, and for GTP, which makes something called tetrahydrobiopterin, which makes neurotransmitters. So you need, you know, a good, you know, a number of different folates, and leucovorin seems to be the one that may be doing that the best.
Great, thank you. What are your thoughts on hyperbaric chamber? Do you recommend it, and what do you think?
You know, I think it's, personally, you know, I think it's a little too early to know. There are some studies that show that there seems to be some benefit from it, but, you know, the results aren't spectacular, you know, and I interpret that as saying that there's probably a subset of children that respond to it, and definitely I've had patients that, you know, have had some great benefits from hyperbarics. But personally, I don't know how to predict that, so I usually don't prescribe it. I usually tell patients to use, if they're going to use it, to use a soft chamber so that they stay at low partial pressures. But I think more research needs to be done so we can really understand the benefits of it.
Yeah, okay, thank you. Another one of our mothers, also medical doctor, would like to know, can we prevent autism by prenatal screening tests? And which one? And could we possibly take one healthy egg cell and healthy sperm from biological mother and father? And yeah, that would be the...
Yeah, I mean, it's a great question. No, we're not able to predict it. There are some tests that have, seems to be very strong biomarkers, maternal biomarkers, which are being developed, but still they're in the testing phase. The question about taking a healthy sperm and healthy egg, I think, is really a kind of a very loaded question in a lot of ways, because we actually see, or at least there's some evidence that there's increased risk of autism with in vitro fertilization. So it could be the parents that need to use in vitro fertilization. There may be something there, or it may be that we just don't completely understand how to fertilize the sperm and egg together in an artificial environment. So I think it'll take a lot of research and a lot of time to figure that one out.
Get there, yeah. Okay, thank you. Few more, and we're okay. One of our mothers went to a conference for neurotransmitter diseases that was in the Belgrade, Serbia this fall, and European metabologist told that diagnosis of cerebral folate deficiency is, which is based just on antibodies, can be unreliable in some way, and they are looking for a confirmation in genetics and also analysis of liquor for folates. So explanation for that is that healthy people have tying and blocking antibodies without any symptoms. So concrete, specifically in Serbia, we does not have analyze for liquor on folates, and most parents did only FRAT test, FRAT test, yeah? So what would be your attitude, and would analysis of folate in liquid would be a mandatory test for diagnostics?
Yeah, again, this is how we started out, was that every time somebody had a positive FRAT test, then we would do a CSF test, and then we gave the parents a choice of whether to do the LP or to try leucovorin because of its safety profile with close follow-up to see if it would help. And in our first double-blind placebo-controlled study, we showed that the folate receptor autoantibody significantly predicted which children would respond to leucovorin. So we know that it's a predictor. Is it a perfect predictor? No. So I think that all of these things have to be looked at in the broader sense. As far as genetics, the genetic causes of cerebral folate deficiency are extremely rare. So that's not the cause. Many times there's case studies, but it's only few. And it comes to really your kind of clinical decisions. You don't always have that information. Sure, should if you want to be absolute, should you do a lumbar puncture in every child? Well, it's a lot to go through. And there's a risk of sedation. And many times it's not done always perfect. So when you measure these neurotransmitter and metabolites in the CSF, you have to have what we call a champagne tap, no blood at all, which is extremely hard to do. And there's centers that are very good at it, and people that are very good at it, which I would trust to do it. But the fact is that we're seeing that it seems to affect a large number of children with folate. Large number of children with autism, that the practical numbers of doing that many LPs is probably impractical. And so, from the response that we've seen with the safety profile, we think that when you have a biomarker, and we're looking for more biomarkers, we're not stopping with just doing the FRAT test, we're looking for other biomarkers. We want to get more and more accurate of looking at kind of blood tests, so we don't have to, do lumbar punctures. But I think with somebody that's knowledgeable, again, I wouldn't just go out and buy it in the store and try it. You want to go to a doctor that's knowledgeable about this in a controlled setting.
Absolutely,
and I think that it's a reasonable medication to try without having to do the lumbar puncture.
Thank you. And after therapy starts with leucovorin, let's say, how much time since introducing the therapy should be done the control of frat test or anything?
You mean repeating the frat test?
Yeah, just to kind of track progress and the situation.
Yeah, it's not an easy question to answer because the frat, the antibody doesn't necessarily go away, and it actually might increase. That might actually be something that shows response because we think folate actually competes with the antibody at the folate receptor. So the value of that is not exactly known. So if there is any doubt that leucovorin isn't needed, we do take children off of leucovorin to see, and we did a study that we didn't publish, just kind of observational, and we found that about half of the children seem to regress pretty quickly after taking them off of leucovorin. So definitely, if it's something that's questionable, we do try and remove it to see if there's any change in, behavior, language, cognition.
Okay, does that mean the support of this folate and leucovorin or anything else, if you come with a new solution, is a lifetime
It can be. Some of these could be lifetime treatments. That's something that's really an open question. And that's why we try and use treatments that have low incidence of side effects and are safe. Yeah. Because if you're going to be on them for a lifetime, you want to make sure that they're not, hurting your body in any way.
Okay, great. Thank you. Since mitochondrial disease can be related with GI problems and system, can mitochondrial dysfunction to have the same problems with it? And that would be first question.
Yeah, we see some of the same symptoms in mitochondrial dysfunction. We are starting to learn there may be a special type of mitochondrial dysfunction in regressive type autism or children with multiple regression. So we're starting to pull out the different nuances of mitochondrial dysfunction. And there are many different symptoms. For example, in mitochondrial disease, when we reviewed the literature for that back in 2012, we did a meta-analysis. We found that children with autism and mitochondrial disease, many of them had, about half of them had motor delays, so delays in actually walking, which tends to be somewhat unusual in autism. And then half of them developed absolutely normal and then had neurodevelopmental regression. So you have two different, subtypes there. So it's not something that there's one specific symptom.
I understand. Okay, what to give with leucovorin? Is it needed something to be given as a support? Is it enough just to give B complex, or you should supplement some vitamins independently, like B12 orally or injections?
It's individual, but definitely we see that sometimes B12 is needed, vitamin D, carnitine, all of those seem to help sometimes when you give leucovorin, but it's an individual thing.
Yeah, it should be definitely first to come to the professional, then not to supplement anything, just by hand. Okay. And one question about mitoswab test, if that is not available, is there any test as a replacement that you would recommend?
Not at this time. Mitochondrial disease, the biomarkers for that, are really something that's in development. So even the best mitochondrial markers, even sometimes, muscle biopsy, doesn't give us the information that we need. Yeah. So it's, it's a little bit unknown and something that's really in development.
Okay, great. And the last question from our moms is, I don't know if you're familiar with the drug called Voditelj for epilepsy. Can it have any impact on mitochondria, and can be used at the same time Voditelj and lithium orotate? I don't know if that's...
Yeah, so Depakote is an interesting drug. If you look at the literature, you know, and we've done a meta-analysis and actually a survey also of parents, Depakote seems to be extremely helpful, you know, in children with autism and epilepsy and subclinical discharges, sometimes when they just have these abnormal EEGs. But also it can be very hard in the GI system. And it also can be very hard on the mitochondria. Mm-hmm. So it's not so easy to use. You know, one of the things that we know that's very important is that Depakote metabolism requires carnitine. And so personally, when I use it, I always give carnitine with Depakote at the same time to protect the liver from the effects of, Depakote. So it can be a very effective drug, but you have to be very, very careful with it.
Mm-hmm. Thank you for recommendation. I do have one more question I misread. If the child is at FRAT positive on binding and is homozygote for folinic acid or has leucovorin intolerance, what would be adequate therapy, by your opinion?
Yeah, so it depends why. So the commercial form of leucovorin has some lactose in it. So then, you know, you can move to a compounded form of leucovorin and without lactose. That usually solves the problem, but there does seem to remain probably a small percentage, 3 to 5% of children that become very hyperactive or irritable, you know, on leucovorin, and sometimes most B vitamins. You know, so it's something, again, that's very individual, and there's not one solution to that.
So, yeah, one size fits all. Okay, thank you very much. I would like to thank you also in the name of all parents for your contribution and the research in the field of autism, which really gives all of us confidence and hope so that many will succeed and be better and get well in a best possible way. I would like to ask you for our last question today, what would be your advice or maybe message to our parents who are watching this?
Definitely to persevere, to make sure that you don't leave any stone unturned, and just keep pushing on for different therapies that may help your child so that they become the best that they can be.
Thank you very much. I would also like to thank Maja Adoric, one of our mothers who provided us contact with Dr. Frye, also Special Surgical Hospital Parks, Dr. Dragi in Novi Sad for providing us a place to shoot this conversation. And also I would like to acknowledge that parents who might need your help can reach you via Frye Euro Autism Care. We will have a link in the description below and also on screen, so they can book their Skype or individual consultation and meeting with you. Thank you again for your time, and we wish you luck in your research further on, and hopefully next time we see you we'll have more interesting information on this subject.
Thank you.